apparatus. This is the picture for the collagen fibers, which are one of three types of fibers present in the connective tissue proper. First, you have to remember here the structure of the collagen fibers. They are formed of amino acids forming three polypeptide chains. Here they are three polypeptide chains, 1 and 2 and the third, and these will form the tropocollagen or the collagen molecule. These collagen molecules or tropocollagens will aggregate together in this staggering manner to form the collagen fibril, which is 1 micrometer in diameter. And the collagen fibers together will connect with each other to form the collagen fiber, and that fiber will form the collagen bundles. As you see in the light microscope picture on the left side, we have here the bundle of the collagen fibers. The fibers itself are not branching, but the bundle may branch at its ends. And these fibers are acidophilic, so that they are red stained. You should also remember 1 or 2 specific stains for these fibers. They are stained with blue color by a stain called Mallory trichome stain, and red with the Van Gieson stain. Also, the characters of the collagen fibers are very important. They are very strong, resist stretch, and they are flexible but not elastic. يعني مرنة لكن مش مطاطة. The boiling will cause the formation of the gelatin, and these fibers are easily digested by the pepsin and trypsin present in the stomach and the intestine respectively. They are easily destroyed by acids and alkalis, and by tanning of these collagen fibers by addition of tannic acid, they will form the leather. Don't forget that the collagen fibers are of more than 20 types. You should remember at least 1 example for each type. Type 1, for an example, it is present in the connective tissue proper, in bones. Type 2, it is present in the cartilage. Type 3, which is a reticular fibers, present in also the loose connective tissue and in the stroma of glands. Type 4, it is present in the basal lamina. Type 5, it is present in the external lamina, which is the basal lamina, but 2 structures other than the epithelium, so it is present in the external lamina of the smooth and skeletal muscle. Type 6, it is associated with 1 and 3. Type 7, it is present in the skin, forming fixing fibrils in between the dermis and the epidermis. So, to summarize these types, we have the following. We have type 1, it is present in the bone. Type 2, it is present in the cartilage. Type 3, it is present in the stroma of glands. It is the reticular fiber. Type 4, it is present in the basal lamina. Basal lamina, which is associated with the epithelium. Type 5, it is present with external lamina associated with the smooth and the skeletal muscle. Type 6, it is in association with type 1 and 3. Type 7, here it is fixing the epidermis of the skin. Here is the epidermis of the skin to the dermis of the skin. It is in this area forming ancholin fibrils in the dermal epidermal junction. This is the second type of the fibers, elastic fibers. The elastic fibers originate from the fibroblast, as we have said before, in the connective tissue. But if they are present in blood vessels like this picture, this and this, they are originating from the smooth muscles. And if they are present in the elastic cartilage, they are originating from the chondroplasm. As regards the light microscopic picture, they are single. They are not forming a bundle. They are single and very thin, and they are branching. In the stained sections by hematoxin and leucine, they appear pink in color. So, by pink coloration, you can see these elastic fibers. Also, they have a specific stain like porcine. It has two specific stains. We have here porcine that will give a brown color. And we have Van Jason that will give a yellow color, which is the same color in the fresh state. As regards the electron microscope picture, the elastic fibers here are formed of amorphous core عديم الشكل ملوش شكل مميز amorphous core of protein elastin, and it is covered by glycoproteins in the form of microfibrils. The fibers here are single and they are not made of fibrils as that of the collagen. Here is the collagen, and the collagen also shows periodicity, which is not present here in the elastic fibers. Core of amorphous elastin, and it is covered by the microfibrillar glycoprotein. Also, you should remember the characters. These elastic fibers can stretch and recoil. This is the meaning of elastic. At the same time, they resist the boiling, they resist chemicals, and they are digested by pancreatic elastase. So its digestion is not in the stomach, it is in the small intestine. It is digested by the pancreatic elastase enzyme. And the function, of course, is to give elasticity in the form of stretch and recoil for the tissue. This is the third type of the fibers, reticular fibers, coming from the word reticulum. These fibers are actually collagen type 3. They are collagen type 3, in which we have two important differences from collagen type 1. What are these differences? Number one, here the tropocollagen molecules make thin fibers. The tropocollagen make thin fibers that are bound together by glycoprotein. They do not form bundles as you see in the picture. Number two, the hexose content. Hexoses, which are types of sugars, of monosaccharides, they contain actually 6 to 12 percent hexoses, while the collagen type 1 contains 1% only of hexoses in its structure. These fibers are formed by the fibroblast, as we have said before, and also the smooth muscles, formed also by the smooth muscles in the wall of blood vessels, and as well as the reticular cells present in the connective tissue. Reticular connective tissue. So the origin is coming from the fibroblast in the connective tissue, loose connective tissue, as well as the reticular cells in the reticular connective tissue, reticular cells, and the smooth muscle cells, when they are present in the wall of a blood vessel. As regards the LM, they form a very fine network that can be stained by silver in black color or by PAS in the purple color. And the staining characters, these are due to the presence of high content of carbohydrates in the form of hexoses. Their function, of course, is to make a reticulum in the glands. In the cavities of this reticulum, the cells of these glands are arranged. So they form a supportive functions for the cells of the glands and organs. Now we will move to the types of connective tissue proper, which are divided into loose and dense. In the loose, we have the loose areolar connective tissue. It is the typical one and the most common type, and you should remember in each type the cells or the fibers or the main component in this tissue. In this tissue, the cells, it contains all the cells we have discussed, but the most common will be the fibroblast that will form the fibers, the macrophage, the fat cell, and the mast cell. As regards the fibers, they contain all the type, the collagen fibers, elastic fibers, and reticular fibers. The matrix, it is characterized by having abundant amount of the matrix, which is soft and jelly-like. This type is characterized by the presence of empty spaces called areolae that can accommodate a large amount of fluid or gases. And this type of tissue is very delicate, and it is very flexible, and it is very vascularized. As regards the sites, you should remember the sites of this tissue. So here, as regards the sites, it is present in all over the body except the brain. هنا مش موجود أبدا في البرين بتاعنا. Okay? طيب. It is present in the dermis of the skin, under the epithelium, in the submucosa, in the serous membranes, around the blood vessels. All these sites are very important sites for the areolar connective tissue, so it is present here under the epidermis of the skin. So this is the dermis. It is formed of this loose connective tissue. Also, it is present under the epithelial lining of the hollow organs like the digestive tube. This is the mucosa, or this is the epithelium. Here, this is the epithelium, and the connective tissue under this epithelium is called submucosa. So, it is present in the dermis of the skin. It is present in the connective tissue under the epithelium. Also, it is present in the serous membranes, which are formed of simple squamous epithelium covering this connective tissue, loose areolar connective tissue. Also, it is present around the blood vessels and nerves. What are the functions of this tissue? Here, the functions here are: number one, it is an area for the exchange of nutrients to and from the blood vessel. Here is the blood vessel. Here is the blood vessel, and this is the epithelium, which is not vascular. The connective tissue here will allow the exchange of nutrients present in the blood vessel to pass to the epithelium and to carry also the waste products from this to the bloodstream. Number two, it acts as a fixing tissue that binds the structures together, so that if you have your stomach here, this is the stomach, it is lined by epithelium, and then it has also a muscle tissue. In between the two, we have this connective tissue to bind the tissues together to form an organ. Also, it limits the spread of the infection. This is a picture for the adipose connective tissue, similar to the areolar, but the fat cells is the predominant structure or component over the others. Here we have the two types. We have the brown, this is the brown adipose connective tissue, and this is the white adipose connective tissue. This is the white adipose connective tissue, and this is the brown adipose connective tissue. Also, as regards the structure, they contain fibers. The fibers in between the fat cells, they are reticular fibers. But around the lobules of fat cells or group of fat cells, we have the collagen and elastic fibers. Then you have to compare between the white and the brown. The white is formed of the unilocular adipocytes and the brown is formed of multilocular adipocytes. The blood vessels in the brown here are more than that in the white. The brown cells here are pigmented and these are not pigmented. This is one droplet, these are multiple droplets. These have the signet ring appearance, these do not have this appearance, and the rounded nucleus and the multiple droplets of fat. The white type is affected by the diet and by the hormones, and this type is not affected by diet. The white type is present widely distributed in the body, under the skin, especially in abdominal wall, and in the also it is present in the mammary gland, also present in gluteal region and in the mesentery, also present around the kidney and the blood vessels. The brown type here, it is present in interscapular region, in the mediastinum, and in the axillary region of the embryo and the newly born, and gradually will be replaced later on by white fat, and very small amount is present around the thoracic aorta of the adult. The functions of the white is the storage of fat, heat, insulation, support of delicate organs like the kidney and the blood vessels, and also it gives the skin its shape and contour. While this brown its function is the heat generation, especially for the newborn infant, where the heat regulatory center is not yet developed. If you are asked why it is brown, due to two factors: the abundant blood vessels and the presence of cytochrome pigments present inside the brown cell or brown adipocyte. This is another type of the connective tissue proper, which is the reticular connective tissue. It's a very delicate type, and it is formed of the reticular cells, which are poorly stained here by silver, and the reticular fibers, which are evidently stained by silver by a black color. Actually, the reticular cells are forming the reticular fibers, and these reticular cells are actually having processes that are joined together by tight junction. This type is characterized to be present in the background or the stroma or the framework of organs and glands like spleen, lymph node, kidney, liver. It's stained, as we have said, by the silver, by a color which is black or brown black. This is the yellow elastic connective tissue present in the wall of aorta, which is a highly elastic blood vessel. It is demonstrating this picture. You can see these wavy elastic fibers. These wavy elastic fibers are forming the main component of the wall of this aorta. In between, you can see these red areas representing the smooth muscles that will form these elastic fibers in the wall, as well as collagen fibers. Here also, this is an area where more collagen fibers are present, which is the tunica adventitia. If you are asked what is this type of tissue, it is yellow elastic connective tissue. And what is the classification of this tissue? It is the dense type of connective tissue proper. What is the main component? The elastic fibers, as you see, is the main component, which are parallel to each other. What are the cells? We have fibroblasts and fibrocytes, in addition to the smooth muscle fibers in between these elastic fibers. What is the specific stain? Here it is porcine stain which gives a color of brown black. What is the function of this? It is an elastic membrane which has a power of stretch and recoil. This is aorta. The stretch will prevent the marked rise of the systolic pressure, and the recoil will prevent the marked drop of the systolic blood pressure. This is a picture showing the two types of wide fibrous connective tissue, which is dense type of connective tissue proper. We have two types of the wide fibers. We have the regular type and the irregular type. The regular type is characterized by the bundles, which are parallel to each other and separated by these rows of the fibroblast and fibrocytes. And the matrix is very little in amount. What is the site of this type? It is present in the tendons as well as in the cornea of the eye. Why it is present in the cornea? Because the regular arrangement allows the transparency of the cornea so that we can see. If they are irregular, the irregularity, as in this picture, will prevent the entry of the light. So, two important sites, which are the tendons of the muscles and the cornea of the eye. What is the function here in the tendon? Is to withstand the stretch coming in one direction. In the other type here, the bundles are irregularly arranged, and as well as the fibroblast in between, they are not regularly arranged. So, this is the irregular, dense. It is the dense irregular connective tissue, wide connective tissue. Where can you find this? It is present in the dermis of the skin. This type is present in the dermis of the skin. We have said before that we have a loose connective tissue in the dermis type, and this also present in the dermis. How come? The loose is present in the superficial layer of the dermis in an area called papillary layer of the dermis. If you see this picture here, this is the epidermis formed of epithelium, and this is the dermis. In the superficial area we have loose connective tissue, which are formed of collagen fibers, elastic, and the connective tissue cells. But in the deep area, we have this irregular white fibrous connective tissue. So, there is no contradictory between the two information. It is also present in the sclera of the eye. Here we have the cornea. This is the cornea, which is formed of this type. But the sclera here, which is the opaque part of the eye, it is formed of this part. Also, it is present in the capsule of glands for protection. Also present in the perichondrium. So again, you can summarize that by the following sites. Number one, we have the dermis of the skin, or the deep layer of the dermis of the skin, the sclera of the eye, capsule of glands, as well as the periosteum in the bone and the perichondrium in the cartilage. This is a picture for the mucoid connective tissue, which is one of the loose types of connective tissue proper. What is the structure or the main features for this tissue? The main feature is the presence of a huge amount of matrix. This matrix is characterized by being soft, jelly-like, rich in mucus and hyaluronic acid. So, you should remember that it is formed of mucus and hyaluronic acid. Then, you have to remember what are the cells present in this connective tissue. We have undifferentiated mesenchymal cells or young fibroblasts. They have stellate shape, as you see, and they have processes, and these processes are joined together. Then, what are the types of the fibers present? We have the collagen fibers and the reticular fibers. The next question, what are the sites? The famous site is the umbilical cord around the umbilical arteries and the vein. Don't forget that the mucoid connective tissue in this umbilical cord has a specific name, which is Varton's jelly. Other sites are the following. We have also the mucoid connective tissue present in the eye. How? This is the cornea and this is the sclera forming the outer coat of the eyeball. Then we have the iris and ciliary body and the choroid forming the middle coat. Then we have the retina, which is the innermost coat. Here we have the lens joined by fibers to the ciliary body. What is important to us in this point is the presence of the mucoid connective tissue in this area. In this area it is called vitreous humor. Vitreous humor in the eyeball. Vitreous humor. OR. Other side is the pulp of the tooth. Suppose this is the tooth and it has a root, and in this root the blood vessels enter in this pulp. This pulp contains the mucoid connective tissue that surrounds the blood vessels entering the tooth. Now let us examine our cell. Here, this is the first picture. Name the cell is pointed out by the arrow. Mast cell. List a visible character. It is full of granules that are metachromatically stained, as they are stained here by red color. Although it is stained by toluidine blue, metachromatically stained. Also, we can say that it is a large oval cell full of granules with a dark nucleus. Mention two of its functions: the production of histamine, heparin, eosinophil chemotactic factor, and leukotrienes. Identify the type of connective tissue proper. It is loose areolar connective tissue. List two sites. It is present in the dermis, of course, in the superficial layer of the dermis, under the epithelium, under the mucosa, in the submucosa, around the blood vessels. Number 3 or C. Mention one function. It is a barrier against infection. It is a medium for the transport of nutrients from the blood vessels. Also, it connects different tissues to each other. Name a cell is pointed out by an arrow. This is, of course, the fibroblast. Arrowhead point to collagen bundles. What is the type of the tissue? And be specific. It is an irregular, because here we have a regular arrangement of the fibers as well as of the cells. So it is an irregular white fibrous connective tissue. Identify the type of the tissue. It is a reticular connective tissue. Mention a specific stain. Silver, Ag. Number C. List two visible characters. It is formed of branching fibers. Here are branching fibers forming a reticulum. What is the type of the tissue? Be specific. It is a regular white fibrous connective tissue. Number B. Mention one site. It is present in the tendon or in the cornea. List two visible characters. It is formed of parallel bundles of collagen fibers and with fibroblasts in between. fibroblast can be seen in between the bundles of the collagen fibers. What is the type of the tissue? Be specific. It is yellow elastic connective tissue. Mention two sites in aorta and in the bronchi. At least one visible character. You can say that the fibers are single, thin, branching. Also, you can add that they are stained brown, black with or seen.